Greetings to everyone. Welcome back to my educational channel on biology. I'm teacher Janet. In this short video, we'll discuss Biology Form 4, Chapter 15, Subtopic 15.3, and we're going to discuss the premenstrual syndrome or PMS that's experienced by women and also menopause. So here's an overview of what we have discussed so far for Chapter 15. The title of this topic is Sexual Reproduction, Development and Growth in Humans and Animals. All right. So we have discussed the reproductive system of humans and then also gametogenesis, which is the formation of the sperm and ovum. Then we have discussed the menstrual cycle. All right. The previous video was about the menstrual cycle. And now we're at this point here, changes in the levels of hormones during pregnancy and miscarriage, and premenstrual syndrome and menopausal syndrome. Okay, so this is for this video, and in the next video we'll discuss the development of the human fetus. So these topics are all important topics for SPM, right? So let's get started. The learning standards are as follows. Number one, we should be able to correlate the changes in the levels of hormones involved with two events, pregnancy and miscarriage. Number two, state the meaning of premenstrual syndrome and menopausal syndrome. Ask this essay question or structured question. Explain the roles of hormones in pregnancy. 4 marks to 6 marks. So what are the hormones involved in pregnancy? They are, two of the hormones involved in pregnancy are estrogen and progesterone. So let's explain their roles. Now, first of all, the corpus luteum will continue to produce estrogen and progesterone for 3 to 4 months after pregnancy begins. So corpus luteum in the ovary will continue to produce estrogen and progesterone so that the levels of estrogen and progesterone are maintained, okay, after the pregnancy begins. Now, this is to cause to maintain the thickening of the endometrium. Okay, estrogen and progesterone maintains the thickness of the endometrium for implantation of the embryo to occur. Okay, now after that, the corpus luteum will degenerate or break down finally after about 3 months. So the production of estrogen and progesterone is then taken over by the placenta, which has developed, okay, until birth, until the baby is born. So this will cause the levels of estrogen and progesterone to increase during pregnancy to a high level. But after birth, the levels of these two hormones will then decrease back to the normal level in a non-pregnant woman. Okay. So to answer our question, what are the roles of these two hormones in pregnancy? Let's look at 3 and 4. Okay. Now, during pregnancy, the hormone progesterone inhibits or reduces the secretion of FSH and LH to prevent new follicle development and ovulation respectively. So when there are reduced levels of FSH or follicle stimulating hormone, this will prevent new follicle development. When there are low levels of LH or luteinizing hormone, this will prevent ovulation or the release of a new secondary oocyte into the fallopian tube. Thus, the menstrual cycle will not occur during pregnancy. Second function of progesterone is to maintain the thickness of the endometrium or uterine lining. And thirdly, it prevents contraction of the uterus. In fact, it will stimulate the enlargement of the uterus in order to carry the fetus, which is growing also, to full term. Okay, so it has to accommodate the fetus inside. The uterus has to accommodate the fetus that is growing. Okay, so progesterone will induce or stimulate the enlargement of this uterus. Okay, now during pregnancy, the hormone estrogen functions to help the uterus grow, maintains the thickness of the endometrium or uterine lining. This is similar to the function of progesterone. And lastly, estrogen triggers the development of the fetal organs. Okay. So if the question is worth 4 marks, try to give 2 functions of progesterone and 2 functions of estrogen. Explain the role of hormones in miscarriage. So the imbalance of the hormones progesterone and estrogen levels may cause a miscarriage in a pregnant woman. Now, what's miscarriage? It is the death and expulsion of an embryo or fetus, leading to an early end pregnancy, usually before the 20th week of pregnancy. So miscarriage can be caused by a decrease in the level of the hormone progesterone, which causes the uterus to shrink. So progesterone is needed to inhibit the contraction or shrinking of the uterus. So if this level is low, it can cause the uterus to shrink during pregnancy. All right? Then this causes the miscarriage to occur, and the fetus will come out from the uterus into the environment. Okay, and then there's a lot of bleeding. Okay, um, from the uterus. Now, progesterone is needed to maintain the thickness and growth of the endometrium or uterine lining for implantation and development of the embryo. So if its level is low, then miscarriage occurs. Now let's discuss premenstrual syndrome or PMS. So uh, girls will face this problem of PMS about 7 to 14 days before the first day of the menstrual cycle. All right? So premenstrual syndrome are symptoms that appear prior to or before a new menstrual cycle begins, or when the next menstruation is about to begin. Okay? So that's how they will know ahead of time that the menstruation is going to occur, right? So premenstrual syndrome will manifest or show itself. It will start to show or come out or appear between 7 to 14 days before the first menstrual period, about 1 to 2 weeks before the menstruation occurs. Now, the cause of PMS is due to imbalance of progesterone and estrogen hormones during menstrual cycle, right? So all these hormones, the level of the hormones in the blood of the females are going up, sometimes down, all right? So this can cause the imbalance in the levels of these hormones, and it can cause the premenstrual syndrome, right? So symptoms of PMS are fatigue, meaning tiredness, as shown here, headache, right? Bad temper, irritable, emotional instability, abdominal pain, that means pain in the tummy area. All right, it seems like stomach ache, but actually it may be related to the reproductive system instead. Okay, so women have to understand themselves when they are going through the symptoms of PMS. Uh, when they are going through all these symptoms, they should get a good nutrition, enough sleep, enough rest. All right, and try to rest if possible. Okay, so to overcome PMS, intake of a balanced diet, have frequent exercise, a positive attitude, get enough sleep, and stay active, right? So sometimes if the symptoms are very bad, then uh, medication may be given to help ease the condition, right? Now the second condition is called menopausal syndrome. So a syndrome is a set of symptoms related to a condition. Okay, so menopausal syndrome is related to menopause and is caused by menopause. So what is menopause? It is a time in a woman's life when ovulation and menstruation stop naturally and a woman becomes unable to conceive a child or bear children, right? So it usually occurs between the ages of 46 to 55 years old. Normally, on the average, is about 51 years old. Okay, 51 years old when a woman undergoes menopause. And if she doesn't have any menstruation for 1 year, then it's confirmed that the menopause has set in. Okay, so the cause for menopause to occur is that with the increase in age, the ovaries will get old and this leads to reduced secretion of progesterone and estrogen from the ovaries, which then causes reduced stimulation uh, and reduced production of FSH and LH2. Okay, so there's reduced stimulation of FSH and LH on the ovaries. So the ovaries will stop producing ova. Okay, because with the lack of FSH or low FSH level, the follicle stimulating hormone, okay, level is low. So this causes the ovaries to stop producing the ovum or ova, as the follicles do not develop anymore. Okay, and there is also no ovulation because there is low LH level, luteinizing hormone level. Right, what are the symptoms? Difficulty sleeping, which sometimes is called insomnia. Low mood means feeling sad or depressed, usually. And then having a bad temper, hot flushes. Now, what are hot flushes? A sudden warm feeling on the face and neck region. Okay, so there's also increased risk of osteoporosis due to low estrogen levels. Now, what is osteoporosis? Osteoporosis is a condition when the bones in the body loses the calcium. There's loss of calcium from the bones, the low estrogen level. So estrogen is needed to maintain the calcium in bones. When the level of estrogen is low in women, it will cause the calcium to be lost from the bones. Okay, and then this will weaken the bones and cause them to become brittle and easily broken or fractured. So that is osteoporosis, a loss of bone mass leading to brittle bones. This occurs in women who uh, uh, women may experience headaches and night sweats, meaning at night when they wake up, they sweat. They wake up because they sweat a lot. Okay, so what are the ways to overcome menopause or to reduce the symptoms of menopause? Firstly, exercise regularly. Secondly, eat a balanced diet and include foods rich in calcium and vitamin D, or get enough sunlight to uh, synthesize the vitamin D in the skin. Okay, then get enough sleep. And for some women, they may go and consult the doctor. The doctor may recommend hormone replacement therapy if the symptoms of menopause are very bad. So in hormone replacement therapy, the woman will be given the hormone estrogen and maybe progesterone in order to increase the levels of this hormone and reduce the symptoms of menopause. Formative exercise 15.3. So let's look at the first question. State the hormones involved in the menstrual cycle and their functions. Okay, 8 marks. So if it's 8 marks and there are 4 hormones, that means each hormone is 2 marks. Okay, give 2 functions for each hormone. So the 4 hormones involved in the menstrual cycle are, now we use the acronym FOLP as we have learned earlier. Okay, so F for follicle stimulating hormone, FSH, O for estrogen, L for luteinizing hormone, LH, and P for progesterone. Okay, now always remember that if in the notes I write FSH, in the exam you have to write out the full name of the hormone. You cannot write FSH. Okay, but for notes we may have to use short form, okay, to cram into the space and so forth and make the notes short. That's why we use the short form. Okay, in the exam always spell it out. Don't just write FSH. You may not get your marks if you just write FSH and LH. Right? Right. Follicle stimulating hormone and brackets FSH. Luteinizing hormone brackets LH. So the acronym is FOLP. FOLP. Now, first of all, let's look at the hormone FSH. Here, our answer is in the form of a table. But in the exam, you cannot use table unless you are discussing differences of 2 things. Okay? So here we write in the form of table, but in the exam, please write out in paragraph form. Okay? For essay questions or structured questions. Unless a table is given to you, for example, in the structured question. Okay? For essay questions, no tables are given. If no tables are given, usually, then you just write it in paragraph form, like in an essay. So FSH has two functions here. It stimulates the secretion of estrogen from the follicle cells in the ovary, and it also stimulates follicle development in the ovary, as its name, follicle stimulating hormone. So it stimulates the development of follicles in the ovary. LH, two functions. It causes ovulation, which is the release of the secondary oocyte from the ovary into the fallopian tube, usually on the 14th day of the menstrual cycle. And it causes the formation of the corpus luteum, which is the group of tissues or a group of cells produced from the Graafian follicle that has burst. Okay, it's the remains of the Graafian follicle. So it also stimulates the corpus luteum to secrete progesterone. Okay, now estrogen. Estrogen repairs the endometrial tissues, or repairs the endometrium lining, the layer of endometrium, and stimulates the thickening of the endometrium. So the menstruation has occurred. So it stimulates follicle development until maturity, and it stimulates the secretion of FSH and LH just before ovulation on the 14th day. So next, progesterone, the last hormone here. It stimulates the thickening of the endometrial wall by making it thicker, folded, and rich with blood vessels in preparation for implantation of the embryo. Okay, the thickening of the endometrium or endometrial wall. So this function is a bit similar to the function for estrogen, which also stimulates the thickening of the endometrium. Now, progesterone also inhibits the secretion of FSH and LH in order to block follicle development and prevent ovulation, in order to prevent follicle development and ovulation of another secondary oocyte. Okay, so this is called the sort of negative feedback mechanism. All right, it inhibits the secretion of FSH and LH to prevent follicle development and ovulation for another secondary oocyte. So question 2, explain the functions of progesterone and its effects on pregnancy. 3 marks. Okay, you can try this question first and we'll discuss afterwards. So functions of progesterone, effects on pregnancy. Okay, so during pregnancy, progesterone helps to prevent the contraction of the uterus and prevents new follicle development. Okay, because it inhibits the secretion of FSH, right? So it prevents new follicle development. It also induces the enlargement of the ureter and uterus in preparation to carry a baby to full term. Okay, for the mother to carry the baby to full term. Actually, what happens to the corpus luteum if fertilization does not occur? So the corpus luteum will definitely degenerate, causing it to stop secreting progesterone and estrogen. And without stimulation of progesterone and estrogen, the wall of the endometrium will not be, the thickness of the wall of the endometrium cannot be maintained. It will degenerate or break down, okay, or collapse. It will break down, and then this will cause menstruation to occur. Okay, this is what happens regularly in the menstrual cycle when fertilization does not occur. Okay, and then towards the 20 something days in the menstrual cycle, the corpus luteum will start to degenerate. Okay, so number 4, in your opinion, what are the ways to overcome premenstrual syndrome? 4 marks. Okay, intake of a balanced diet, frequent exercise, positive attitude, get enough sleep, and always be active. Okay, that's all for this lesson. Thanks for viewing. Please do share, like, and subscribe. And Till we meet again, goodbye for now.